Hi, I'm Courtney and this is my intervention video for lower body dressing. This video will be discussing lower body dressing after spinal surgery. I'm also going to touch on how to get in and out of bed and how to get on and off a chair or the toilet. We will be talking about how to use a sock aid, a shoehorn, and a reacher during your recovery period. One thing to remember when completing your lower body dressing and pretty much any activity you complete during your recovery after spinal surgery is to remember your BLTs. This means that you do not want to have any bending, any lifting, or any twisting during this time, or it can cause further injury. First, let's quickly touch on how you would go about getting yourself out of bed. That way you have an idea for future reference. First of all, you don't want to just roll over right away and get straight out of bed because that can cause further injury. The first step you want to take is rolling over onto your side, but make sure your knees are bent at this process. This stops the twisting of the spine from occurring. Next, move your feet off of the bed before you push off with your arm in this process. You next want to sit on the very edge of the bed before using your walker to help you push off and stand to complete the process. You want to take similar steps when getting off of your chair or off of the toilet every day. When using a chair or a toilet, you want to make sure that they are lifted higher than they normally would, so it is easier to get from the chair into your walker without causing any further injury. You also want to make sure that you are not sitting on a chair or couch that has too much cushion, because that will make getting up even more difficult. Along with making sure that the chair is higher up off the ground and not too soft, you want to make sure that there are arms or handles on the chair for you to reach back at when you stand up and sit down again. When you want to stand up, make sure your walker is in front of you. Sit on the edge of the chair and use those arms to help yourself push up before grabbing the walker to start. Now I am going to demonstrate how to use some of the assistive equipment that you will be using throughout your recovery period. First of all, make sure all the items you need for dressing, including your pants, socks, and then all of the items you will be using, the shoehorn, the sock aid, and the reacher, are next to you and close by, so you do not have to do any bending or twisting. First, I will be demonstrating how to use a sock aid in putting on your socks. Now mine looks like this, and they generally are shaped like this, and this is cloth, but they can also come in hard plastic. The first step is placing the sock on the sock aid. And you want to make sure the strings are closest to you and farthest away from the part that is going to point down when you're trying to put your sock on. You are going to start by placing the sock on the end farthest away from the ropes, and make sure you pull the sock until it is all the way on. Tie the two handles and toss it out in front of you. Then you will take the handles and pull it closer, placing your foot into the sock, and using the rope handles, pull up until the sock is completely on. While using the sock aid, you want to make sure that while you have the handles in your grip, that you toss the sock aid as far as it can go in front of your feet. Once it is in front of your feet, mostly in front of your toes, you will then continue the process of sliding your foot into the sock aid, using the ropes to pull it up, so your sock is then slid onto your foot. The purpose of this assistive device is so that the patient does not have to bend or twist to get their socks on every time they want to wear them. Next, we are going to demonstrate using the reacher to help put on your pants. Now you want to make sure the pants you choose to wear are loose fitting so they do not irritate any incisions that you might have. This is generally what a reacher looks like. This is an average size, but they do come shorter and longer depending on your height and arm length. You are going to start out with your pants laid flat in front of you. You are going to grab your reacher and use them to grip the pants. You are then going to insert one leg. And if you had hip or knee surgery, you're going to want to insert the bad leg first. Next, go ahead and insert the good leg and pull them up as far as they will go without any bending or twisting. Next, you are going to grab your walker. You are going to reach back with one hand, stand up out of your chair, and then continue to pull the pants on the rest of the way. Now, if you want to sit back down, you're going to make sure you reach back again with one hand, then the second hand, and then sit down without any bending. Or we are now going to use the reacher to help take off your pants and socks. So you're going to want to stand up using proper technique and take the pants down to the knees before sitting back down. Then grab your reacher. You are going to grab the pants, remove the good leg, and then your bad leg. And then you are all set. You can also use the reacher to help take off your socks. You can either use the grip part, or there is a little knob right here that can be used. I find it easier to use the grip part, and I think you would too. So you're just going to grip inside the sock, and you will pull it off. Simple as that. The last device I'm going to show you how to use is the shoehorn. Now, this is a short-handled shoehorn. Generally, I would say you should use a long-armed shoehorn so you don't have to bend, but I'm going to be demonstrating with this short one. It does the same, but it might involve some bending. Generally, using a shoehorn is pretty simple. It's just there to help you slide your foot into your shoe. Now, the types of shoes you're probably going to want to wear are slip-ons, Velcro, or shoes that are tied loosely that you can easily get onto your foot with the small amount of assistance from this device. First, I will talk you through the steps of using the shoehorn, and then I will demonstrate for you. The first step to putting on your shoe is grabbing your shoes. Now, if you're in a chair, you can use the reacher if they're on the ground. If they're next to you on a table, go ahead and grab them and use the reacher to put them on the ground, so this way you do not bend or twist. The next step is to slide your foot part of the way into the shoe, and then this is where the shoehorn is going to come into place. You're going to stick it at the far back of the shoe near the heel, and this is going to help you slide your foot in because it does not cause friction between your socks and the plastic. So your shoe or your foot will slide right into your shoe without you having to bend over and fix the heel of your shoe because it's bent in between your foot and the shoe, and you know how uncomfortable that can be. Okay, so first step is to grab your reacher, and then we will grab one shoe and put it in front of your right foot, then your left shoe in front of your left foot. Put the reacher down. We have our shoehorn. I'm going to slide my foot into this shoe easily. Then I will take the shoehorn. It is now against the heel of your shoe, and your foot's just going to slide right in. And then you remove the shoehorn, and then you can repeat it for the next shoe. Shoehorn goes in against the heel of your foot and the heel of your shoe. Your foot easily slides right in without any problems, and then you just remove the shoehorn. Now you can also use it to take off your shoe. Just put the shoehorn back in the shoe and easily slide your feet right out. Shoehorn in the same place against your heel and the heel of the shoe. And slide your foot right out. And then if needed, you can use the reacher to put your shoes off to the side so you don't fall while walking with your walker. Now for a quick recap of the 3 different devices we used for your assistance after a lumbar spinal surgery. We have the shoehorn, used for assisting you in putting your shoes on and taking them off. Next we have the reacher. This can be used for putting on your pants, putting on your socks if you don't have a sock aid, taking off your socks, taking off your pants. It can even be used for other things like reaching up into a high cupboard so you're not straining your back. If you drop something on the floor, it can be used so you're not bending something off to the side that you need to grab, and you want to make sure you're not twisting. So this is a very versatile device for you after any type of surgery. Last is the sock aid, which is used to help you put on your socks. It is not used to help you take them off. You want to make sure you use the reacher for that part. I want to thank you for watching this informational demonstration video. I hope it was somewhat helpful for you if you ever have surgery in the future, or if you need to help a family member or a friend after they might have had any type of back surgery.